just don't know why they're feeling full.
Yeah.
Why their ears are feeling full, rather. We know
It's
why
the
their
holiday
hearts are
season.
full.
We know why they're full.
Why their bellies and their hearts are full, right?
Exactly.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Not only is it Christmas, but it's the very last episode of Ask an Audiologist for this year. I'm Kevin Ziener.
And I'm Dr. Michael Squires.
It's just Christmas music today, Michael. That's all we're doing.
Oh,
we're only
Merry Christmas.
listening to Christmas music for the entire 10 minutes of this podcast.
Yep.
But also to celebrate the festive holiday and to round out 2023, Dr. Michael and I are going to be spending the entire episode talking about what can cause that feeling of fullness in the ear. This music is almost too much. The article in question today was written by Dr. Meg Kalady of Kalady Audiology in Beaufort, South Carolina. So, Dr. Michael, with the bed of jingle bells playing beneath you, let's honor both Christmas and the New Year by telling people why their ears are full and how they can cure it.
We've got full ears and full hearts as we round out the year.
Oh
right?
my gosh, I feel like we nailed it or we are going to be canceled.
One or the other.
Immediately once this airs.
It's a risk I'm willing to take.
Christmas presents are full. Stockings are not full of charcoal.
Nope.
We are full of information. Your ears are full of something, and we can't wait to give you the insights on why your ears are full.
Oh man, we need to just get into the topic.
We haven't even had any eggnog yet. This is us stone cold sober talking about fullness in the ears.
Yeah. So fullness, I see it a lot in my neck of the woods.
Okay.
Lots of different things can cause fullness. And I'm going to be honest, there are some patients that I see that everything checks out and it's completely normal.
Yeah.
And we just don't know why they're feeling full.
Yeah.
Why their ears are feeling full, rather. We know why
their hearts
are full.
We know why they're full.
Why their bellies and their hearts are full, right?
Exactly.
But, in terms of fullness, the most direct thing that we typically go to is how are the eustachian tubes functioning, right? We will run tests like tympanometry to find out what the middle ear pressures are, how that eardrum is moving. Is it doing what it's supposed to be doing? And if we're seeing lots of negative pressure, if we're seeing some fluid buildup, naturally that's what's going to cause that fullness.
Sure.
And in terms of treatment for that, oftentimes you're going to be seen by an ear, nose, and throat physician or an otologist. Sometimes this can be managed by a primary care physician as well. And they're going to typically go down the route of perhaps nasal decongestants or antihistamines, or in some cases, antibiotics if we're talking ear infections.
I feel like I've heard about, I've used Afrin before.
Yeah.
And though Afrin's over the counter, I hear endless people say, do not use it more than once every 12 hours because your body gets dependent on it super fast.
Yeah. Typically what I see in terms of what our local physicians are referring for is like Flonase. Something like that, just something to knock those allergies down a little bit.
Got it.
Whatever depending on the time of the year.
Sure.
But if it's an ear infection, then we're talking antibiotics, and in a more extreme version of that, then perhaps we're talking about placement of pressure equalization tubes.
Got it.
And oftentimes when our ears are feeling full and it's related to some of that pressure or fluid or something related to that, then those pressure equalization tubes very quickly will alleviate that issue. Of course, we've talked about that feeling of going up, up in an airplane or up in the mountains when you're driving, and you feel like your ears need to pop.
Yeah.
Then you can gently hold your nose, gently breathe, kind of filling your mouth up with air and push some of that air up. It's called a Valsalva maneuver. And sometimes you can get your ears to pop and get rid of that fullness feeling.
I have, when not during the holiday season, not when it's freezing cold, I enjoy a good swim, as I'm sure you do as well. Obviously, the longer you're in the water, the more susceptible you are to getting water in your ears. That's typically the time I'm the most aware of that full feeling. And it's obviously because it's just sloshing around. What is the best thing to do to get water out of your ears besides just smashing your head back and forth and causing vertigo?
Shaking like a dog.
Yeah.
I like the
You like that treatment instead?
Yeah, just shake it like a dog.
Banging your head into one side.
Yeah, definitely. So there's a couple things you could do. We as audiologists are trained and it's beat into our heads that you don't put anything smaller than your elbow in your ears.
Got it.
So Q-tips are not the correct answer here. I'm smart and savvy.
With the idea that they would like absorb the water or something?
Yes, exactly. And oftentimes it just can end badly.
Yeah.
You know, I'm smart and savvy enough to realize that people are going to use Q-tips anyway. So what I typically recommend is don't use Q-tips.
Yeah.
But if you're going to, put your fingers at the end of the cotton and only go in that far.
Got it.
Okay, that's it. It can be really dangerous. We see all kinds of things following Q-tip injuries, or the cotton tip applicator will come off into the ear canal. But to answer your question, oftentimes you can just, when you're sleeping at night, if you roll over on that side, it'll come out.
Yeah.
Or you can put a few drops of alcohol in there, and that alcohol will mix with that water and help it to evaporate a little bit more quickly.
Like when
there
should
are also ear drying drops,
Got it.
but basically the active ingredient is alcohol.
I was going to say, when should I be concerned about that fluid staying in my ear?
Yeah, good question. And it can certainly cause fullness if we start to get swimmer's ear, or what we call an outer ear infection, right? So you get that water that sits in that ear that you just can't get out. Maybe you've tried drops. Maybe you've, maybe you shake like a poodle.
Yeah.
And the water just does not come out. It sits in there. It becomes a harbor for bacteria, and then you end up with an ear infection. And so that's when you're going to want to start to seek medical treatment. Don't let that ear infection fester there for too long, because it can become really nasty really quick and very painful very quick.
Yeah. The other thing, and obviously you're talking about eustachian tube and all that kind of stuff, and my layman brain goes to like full ears being just like the ear canal, the middle ear, like, and then obviously earwax.
Yeah,
as
we don't
well.
want to discount earwax. Definitely. I have patients come in. It can go one of two ways. I've got patients come in to get their ears clean, and I look in there and they go, oh, my ears are full. They're driving me crazy. And they're completely clear. Huh. Yep. And that's when we start to look at tympanometry and eustachian tube and things like that. Yeah. And then the other side of that, they go, oh, my ears feel really full. Can you just check them out? And they're full of wax. Yeah. So then cerumen removal, cerumen being earwax, we take that out for you, or you can have your primary care or another physician irrigate that and get that blockage alleviated, and then that fullness should alleviate with it.
All right, hijacking this conversation and pivoting back hard to Christmas.
Nice.
Dr. Michael, looking back on your life, what would you say is your favorite Christmas gift you ever received? And say of us the sentiment like, oh, a child.
Oh, come on.
That's a layup.
2 out of my 3 kids are born in December.
I know. That's why I had to preempt it.
My daughter's the 28th. And so I'm going to say that, and all 3 of my kids are born in that holiday season. And so I'm going to say my kids, absolutely.
Okay.
But if I have to go like way back,
as an outdoorsman, I imagine like the first hunter's thing you got.
You went for it. Yeah. My dad bought me a Browning A-Bolt.
Wow.
Yep. And so that's my 30-06. I love that rifle. And I've hunted a lot with it.
You still have it?
Oh yeah.
Very cool.
Oh yeah.
I remember, and this is just very symptomatic of a West Coast kid. One of those little electric 4-wheeler Jeeps.
Oh yeah.
Though up and down the street.
Pow, pow, power wheels.
Exactly. The thing went all of a half a mile an hour, and man, did I think the wind was blowing through my hair.
Flying.
Loving it. Okay, what is a quintessential Squire's Home Christmas meal? Something that you hunted with the rifle, I imagine.
Oh, well, gosh. Christmas, we'll either do ham or turkey.
Okay.
Yeah. Yep. So our Christmas ends up looking a lot like our Thanksgiving.
Nothing wrong with that.
I think it's just in my past. That's how my family's always done it, and that's how we carried on. My wife likes to switch things up a good bit, so we do a lot of different styles with dressings and things like that. Yeah.
Yeah. So. We don't have like a traditional meal. I think the tradition is changing it all the time. And it kind of, obviously beef is around, but a beef Wellington or like a pan fried steak or a grilled steak or some type of prime rib, it's always a switch up. And then some type of potato dish, whether mashed potatoes au gratin, scalloped potatoes, something like that. Yep. It's always whatever the moment calls for.
Most often we're going to incorporate rosemary and cranberries.
Oh, of course. Quintessential tastes of Christmas and smells of Christmas. So if you find yourself bored of opening presents and in need of some audiological inspiration, head on over to askanaudiologist.com. We can promise that you'll not only learn something, but that you'll be on Santa's nice list all next year.
Ho, ho, ho!
Santa, I mean Dr. Michael. Merry Christmas and Happy New Year to you.
Happy New Year. Thank you, Kevin.
We'll see you guys next year.
See you guys.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.